As opioid use continues to plague America, one company is offering hope if you are addicted to drugs or alcohol. California-based BioCorrects is using a revolutionary technique to combat addiction. It is truly amazing. Joining us now to explain how this all works is BioCorrects CEO. His name is Brady Granier. Thank you so much, Brady, for being here.
Thanks for having me.
How does this work?
Well, naltrexone has been around for a long time. It's been FDA approved since 1985 for various in oral and injectable form. It basically blocks the receptors in the brain that give you that craving. So it can block cravings. It attaches to those opioid receptors. So it can block cravings for alcoholism. It can also block certain effects of alcoholism and opioid abuse,
such as heroin. So if it's been around for so long, why are we just finding out about it?
Many reasons. There was a compliance issue in the pill form back in '85. It was, people just didn't take it. It lasts maybe 4 to 6 hours in a pill form. You have to decide every day whether I wanted to take this or my best friend, the drink, or the drug of choice. Cut to today, there's many sustained release forms that are either injected or implanted that takes away that compliance issue. Wow. And now because of the opioid epidemic as well, we're searching for answers and solutions.
And it really works. People who take this, they're not addicted anymore because there's no cure to this, but it helps.
Yeah, right. Let's be clear, there's no cure to addiction. It's a chronic disease of the brain. It is a disease. That's a debate by some people, but it's a disease of the brain, so it needs to be managed. So this is just a tool to help someone get through the rough patch of those physical cravings, or actually protect them from overdose as well while they go through psychosocial treatment to get to the underlying causes of the addiction. So there's no cure. It's not a panacea. This is just another tool in the toolkit, but it's a very effective one. Okay,
Brady, I know you brought a video for us to see. For the folks at home, tell us how it works.
Well, with the implant, it's surgically implanted in the lower or right quadrant, 20, 30-minute procedure.
Does it hurt?
Local anesthesia, no, so it's very, it's relatively painless. It's inserted, and a few hours later, the medication starts making its way into the blood system, and it can stop. People report that after 2 to 3 hours, they stop craving alcohol and the effects of opioid abuse.
How long does it work?
This implant will typically, there's various implants on the market. This implant will last several months. It varies from patient to patient. We like to say that it lasts typically long enough to get through a lot of psychosocial treatment so that that person can have a better chance of long-term sobriety by dealing with the underlying causes. Again, this is just a tool to help you get through
How much does it cost, and does insurance cover it?
Some insurance is starting to pay for it, PPO insurance. That's where we really need a lot of help. It really does work. It ranges from coast to coast, depending on the treatment provider. They're integrating this into their own program. So we like to say it's probably a third or a half of the cost of a traditional 30-day stay in a rehab for a program that lasts about a year. Okay,
and if you don't want to do the implant, you can inject it if you want to see how it works.
There's an injectable product already on the market that's been FDA approved for quite a few years. It's a once-a-month injectable. We're also developing our own version of that injectable called BICX 101 right now. We're in preclinical development, and we're waiting for the FDA to respond to us.
Okay, so we're out of time, but I do want to say the name of the drug in case people want to ask their doctors. What's the name of it?
Naltrexone.
Naltrexone. Okay, great. Thank you so much. You're saving lives, jobs, families. It's awesome.